Hello and welcome to Picture of Health, our new talk show bringing you information and tips about how to get healthy in Polk County. We are starting our first episode of this show with a conversation about one of the most complex, overwhelming, and alarming epidemics in America today, obesity. Obesity is a serious and costly health issue that affects everyone living in the United States. The CDC reports that 34.9% of US adults and 17% of children are considered to be obese. And it is predicted that by 2030, obesity rates will increase to 42%. Today, we are joined by Dr. Joy Jackson, the medical director of the Florida Department of Health in Polk County, to talk about how obesity is affecting our state. Welcome, Dr. Jackson.
Thank you very much.
How does the obesity rate in Polk County compare to the rest of the United States?
Well, as you mentioned, the rate in the United States is actually quite high at 34%. The obesity rate in Polk County is about 37.6%. And the state of Florida is 27%. So we're significantly higher than the state of Florida and the United States. So we know we have a real problem.
Why do you think the obesity rate here is higher?
Well, you know, there's multiple reasons for obesity to develop, and the bottom line is it's pretty much not enough activity and not eating proper foods. And we know from looking at trends over the years, the obesity problem has been developing for the past 20 to 30 years. It's been a very slow, gradual increase. So I think there's lots of reasons. It's not one or two reasons, but it's lifestyle, life choices, and lack of activity, which probably are the biggest issues.
Now, in some cases, two people can have the same unhealthy diet, and yet one person can remain healthy and underweight or the normal weight. Why is it that the other person, gains weight compared to the other person?
Well, certainly there's differences in metabolism of people. Some people are naturally movers, they fidget, they move. There's also genetic reasons why some people may metabolize foods more quickly. There's no simple answer to that, and I agree, sometimes it doesn't seem fair. My husband and I can eat the same things, and I gain weight and he doesn't. And there are differences, but each person needs to learn what impacts their own life and their own weight.
Now, do you know if, or can you talk about any misconceptions about obesity that some people may have?
I think there's the inevitability of it, and if being overweight is something that's to be expected, and I think that's not the case, but it's something we all need to strive to not be overweight and obese. It's difficult when you look around and you go into the grocery store or a restaurant or to the movie and you see so many people that are overweight. But it's not inevitable, and it is a condition that can, with time, be brought under control. And what we'd really like is for people not to become overweight or obese to begin with. So prevention and working with the youth and with families is absolutely critically important.
Now, I know for some people it's very difficult, to control their diet. But what can you say to our viewers to convince them that this is really a big problem in terms of what's happening in Polk County in order for people to maintain health and the urgency of this epidemic, if I can say that?
The perspective from the public health standpoint is that obesity is an epidemic, and it is actually a crisis not only in Polk County, the United States, but also the world. But from an individual level, not to be overwhelmed, we each need to think of ourselves and to have discussions with your healthcare provider about what obesity or being overweight means for your health personally. We know folks that are overweight or obese have a higher incidence of chronic diseases such as diabetes, hypertension, high lipids, stroke, gout, arthritis, about 10 or 12 different types of cancers, depression. So there are many conditions that are associated with obesity. And in fact, some people view obesity as being a chronic disease in and of itself, but it clearly impacts so many other conditions. And you know, we hear from folks that have lost weight how much better they feel. So that is an initial impetus that you just plain feel better. Mm-hmm. You don't hurt, you're not as tired. So there are other reasons, and to talk to, a person should talk to their provider about that.
You said something about the connection between obesity and a lot of the chronic illnesses that affects a lot of people, not just in Polk County, and not just in the state, but all over the United States. How can we make people understand that obesity can affect how they can live life as healthy as possible, and to prevent them from getting heart attacks, diabetes, hypertension, and even cancer?
Mm-hmm. Well, I think there are a couple of approaches. And number one, the best offense is prevention. And that's working with our parents to have them look for lifestyles that are healthy for their children, and their children will then also teach the parents. We're really, with our new campaign, which we'll talk about in a few minutes, which is 5210, we're really focusing on the youth because we think that will have a very strong impetus to change lifestyles. But for a physician or an ARMP or PA to have discussion with an individual about the impact on their health is very, very important.
You said something about the importance of starting children on the right path to a healthy lifestyle and eating properly. How can parents do that? Because when they go to school, you know, they are tempted with vending machines and sodas and different kinds of other food that can contribute to them being obese and having an unhealthy diet.
I believe the schools have gotten much better about taking foods and drinks out of machines that are unhealthy. So the school board and the school system is very much on board with these healthy initiatives. What we are proposing and what is being used across the country is something called a 5210 campaign. 5210 is simple, and these are lifestyle choices that a child or a parent or a family can participate in. 5 means that you should have 5 fruits and vegetables every day. 2 is for no more than 2 hours of recreational screen time. It's TV, video games, computer time. 1 is 1 hour of physical activity, and 0 is 0 sugar-sweetened drinks. And if each one of us participated in those efforts, I think we would definitely make an impact.
I also heard that the Department of Agriculture is very much involved in making sure that the food being served to our children in the schools are the ones that are being recommended by pediatricians and by healthcare professionals, so that they can start off with having a healthy diet even in school. How does that affect the kinds of food that are being served in our schools today?
I've heard that as well, and I've heard some statewide speakers that speak to that, and I do know that is definitely an effort. I think what children eat at school is critically important. They're learning to eat fruits and vegetables they may not be exposed to. Many schools across the county actually have gardens where children are participating in growing food. I think kids sometimes are more likely to eat something if they know where it came from and how it grew. Brilliant ideas, and we're looking for creativity. There's no one thing that can fix the obesity epidemic. We're creating a culture of health and wellness, and that involves being active, and that involves eating healthy food and staying as basic as possible with fruits and vegetables.
Okay. So we are at least doing something in the schools, but how about when they go home? Because what I hear is that it is so much easier, you know, for parents, especially if they're working and if they're busy, to, when they pick up their children, just to go over to a fast food store and have McDonald's or, you know, whatever is available in the area. How can we entice parents to change that routine?
And I hear you, and I think that's probably behavior is one of the most difficult things to change. And you know, it's called planning. And those of us that are working moms or working dads, working families, it's difficult to make last-minute decisions and have them always be healthy. So planning when you do your grocery shopping, what am I going to have in the house for the child? Fortunately, some fast food restaurants are trying to put more healthy options, and the requirement for calories to be on menus is expanding. So I think that there is some assistance coming to help change the culture, and there are healthy snacks that kids can eat, and parents having them available and holding the children accountable. Let's get them home and let's let them play for an hour outside, rather than sitting for 3 hours in front of television with snacks that are unhealthy.
Okay, all right. Now let's take a quick break to learn about nutrition from Whitney Fong, who works at the University of Florida's IFAS Extension. Stay tuned and we'll be right back.
Hi everyone, my name is Whitney Fong and I am with the University of Florida IFAS Extension Service and the Innovent Healthcare, which is funded by the half-cent sales tax of the Board of County Commissioners. So I am the Family and Consumer Sciences Agent, and I go all over the county and I provide nutrition education. Today we're going to talk about My Plate and how do we make some healthy choices. So first question is, do you know what My Plate is? Who's seen this before? And so this, if you remember the food pyramid, My Plate replaced My Pyramid in 2011 as the USDA recommendation for every American over 2 years old to have a healthy diet. And so basically, if you're going to eat lunch or dinner, whatever meal you're having, you sit down, look at your plate, and see if your plate looks just like My Plate. And so you have a plate, you cut it in half. Half of the plate should be fruits and vegetables. So more of those good things, those fruits and vegetables, locally grown, that have lots of vitamins and minerals that keep us healthy. A quarter of the plate are your grains, and your grains are your breads, rice, cereal, and pastas. And then a quarter of your plate should be protein. And those are your meats, your pork, chicken, seafood, fish, but also your eggs and something like peanut butter. So that's your quarters. And then don't forget your dairy. Dairy foods are foods that provide calcium, which are your milk, cheese, and yogurts. And so there's two main messages of My Plate. The first one is to eat all 5 food groups every single day. And so you notice all the different colors. You want to make sure you have all 5 food groups. So ask yourself, if for lunch you don't have a fruit, then how are you going to get your fruit later on during the day? So every single day, have all 5 food groups. And the second message is to portion control. And you see how the plate's kind of divided up? A lot of times people will say, oh, hey, my kids should eat that, use that plate. But really, it's an adult plate and we all have different portion sizes. And so number 2 message is to portion control. We want to make sure that we have all these quarters on your plate. And if you have a steak that's smack dab in the middle of your plate, then maybe it's a little too much. So remember those messages, and you can find more information on choosemyplate.gov right here, choosemyplate.gov. And there's a lot of different types of healthful resources. And so we've talked about My Plate, and so you might be wondering how much of what foods we should be eating. As we go through these sessions, we will be talking about different types of things in detail. So you have that overview of My Plate, and here's a quick synopsis of the different portion sizes. So we have a preschooler, we have kids, and we have adults. So let's use fruit servings for an example. So for fruit for a preschooler, you're going to have a quarter of a cup. A quarter of a cup to a half a cup, and this is a quarter of a cup. And so if you have measuring spoons at home, you might use a quarter of a cup. A half a cup is about this much, and this should be for your kids. So it could be a half a cup of bananas, a half a cup of strawberries, or whatever fruit that you're going to consume. And then for adults, it's right here. For adults, it's 1 cup, and 1 cup is about this much. And we'll go into the portion sizes a little bit more into detail in future sessions. And you might be thinking also about My Plate and how do we build that healthy plate. You know, we have the vegetables and you have lots of vegetables and you're always eating salads, but if you put a lot of the dressing on, that might not be a healthy balanced diet, right? So catch us next session. We're going to be talking about the 10 tips to build a great plate. Thank you for being with us. My name is Whitney Fung. Feel free to call me if you have more questions. See you next time.
Thank you for staying with us here on Picture of Health. If you're just tuning in, we are speaking today with Dr. Joy Jackson, the Medical Director of the Florida Department of Health in Polk County, about obesity. Dr. Jackson, I understand that you are a member of an initiative, Building a Healthier Polk. Can you tell us briefly about it?
I'd be happy to. Building a Healthier Polk is a community project being led by Polk Vision. And this is a project to fight the obesity epidemic in Polk County. This started about 3 years ago as a result of our community health improvement plan, where a group noticed that obesity was probably our #1 health risk. So Polk Vision created Building a Healthier Polk, where multiple community partners are involved in this group. We meet regularly, and we've identified 6 strategy areas to fight the obesity problem. These strategy areas include school-based strategy, higher education, physician strategy, community strategy, and information and communication strategies.
Can you expand more on the different strategies that this initiative is advocating?
Sure. In the school-based strategy, we had very good support and representation from the school board membership. And the initiatives there has led to things like fitness grams being used in schools, and children are actually given fitness grams. They are promoting the 5210 campaign, which I mentioned earlier, with the 5 fruits and vegetables, 2 hours or less of screen time, 1 hour of activity, and 0 sugar sweetened drinks. And there actually have been exercise programs also that have been started within the school system. So that's been tremendous, and we've had very good support of the children. From the standpoint of our physician provider strategy, again, we are promoting the 5210 campaign, and we have 4 clinical practices in the county of pediatricians who are using 5210 prescriptions as conversation points for children and achieving commitments from these children as to what they're willing to do to go toward a healthier lifestyle.
Now, who are the members of this group? The initiative for a healthier Polk? Are you getting just physicians, other healthcare workers?
Building a Healthier Polk membership obviously involves Polk Vision. It involves the Department of Health. There's representation from the school system, from colleges, from businesses, from the Polk Wellness Professional, from independent wellness professionals, from churches. We just have lots of members, and it's just been an incredibly rewarding experience to meet monthly with folks to really envision how we can fight this problem with obesity.
Okay, so basically we have a lot of buy-in from the community in order to make sure that we are promoting a healthier Polk. Since this program was started, you said 3 years ago, have you seen any improvement in the obesity rate in Polk County?
Yes, it's been a small amount, but we have, the last statistics show that our obesity rate has dropped by 0.7%. And this is a start, considering it's taken years to become overweight.
Okay, so basically you think that this group being put together really can help, or has helped, in terms of making sure that we tackle the problem of obesity in Polk County.
Absolutely. And then we're also looking at the county and the cities promoting places for folks to exercise. You know, we have a wonderful trail system. We have wonderful parks. And this is in a lot of planning activities for the cities and the county.
Now, how do you think has obesity impacted the industry or the organizations, the businesses in Polk County? Do you know if they are also having programs, you know, to help their employees live healthier lives and prevent obesity? Absolutely.
And there have been, I believe, 17 businesses that have reached out to the Polk Wellness Professionals who can assist them with developing worksite wellness and health programs. And that's been very rewarding, and this group is very willing to go out to other businesses. We know that folks that are obese have more absenteeism from work. They tend to have more sickness. So it's certainly within, I think, the benefit to a business to have healthy employees.
And from my conversations with other professionals, healthcare professionals in Polk County, it seems like businesses and even the city organizations are more and more getting into the notion that keeping healthy employees can reduce absenteeism, can improve productivity within the organization. How does you or the health department communicate with these organizations to make sure that we know what they're doing and how it is affecting the data gathering that the health department is doing in terms of obesity?
I think the role of the health department is to be a liaison and a communicator of what the statistics are showing. So we really don't have any authority to tell somebody they must do something. We can't tell an individual what they must do in this regard, but we can serve as a communicator, and we can help bring people together to work together, to align ourselves to fight this problem and to really change a culture. And that's really the role of the health department.
How has obesity affected the healthcare industry?
Tremendously. Having worked in the hospital for a number of years, we know that obese patients tend to have a longer length of stay. They tend to have more complications of anesthesia. They tend to have more issues with infections being more difficult to treat. Certainly they have a higher incidence or risk of deep venous thrombosis or other blood clots. We have many patients that can't fit in hospital beds anymore. It's more difficult because operating room tables and x-ray machines are more difficult when somebody is obese. Dosing of medication is very different when somebody is obese, and that's really been explored more and more now, because historically in the past you dose medicine based on ideal body weight, not their true body weight. So there's a lot of thought going in to taking care of patients who are obese.
Okay, so basically the cost factor is there.
Absolutely.
Because of the longer length of stay, and also hospitals having to equip themselves with specific equipment that can accommodate,
Right.
you know, the people who are obese.
Absolutely.
Let's take another break to check out what's going on over at the Polk Healthcare Plan's mobile unit. Stay tuned. You're watching Picture of Health.
The mission of the Indigent Healthcare Plan is to provide a wide variety of services to those residents in Polk County who are in poverty, who cannot afford to receive care through traditional providers and do not have insurance. The mission of the mobile unit is actually so that we can get out into the community. It's actually a mobile office on wheels. We also have a nurse in that mobile unit quite often who does routine health screenings, and those screenings are available to anybody who's in that community. And we have a worker on that unit that does eligibility determinations for the programs that are available through the Indigent Healthcare Division. And that's what he does. He brings the services to the people in the communities that often have a hard time finding transportation to get into our traditional offices. Well, we actually can do 3 health screenings on the mobile unit, which one is for blood pressure, one is for diabetes, and the other is for cholesterol. Quite often, those are diseases that people have, and if they're not going to a traditional doctor on a regular basis, they may not know they have them. And that's why they call, for instance, blood pressure is the silent killer, because people will have it, they'll have a stroke because their blood pressure gets so high, and they never even realize it until that moment that they have that stroke or need that care. Same with diabetes. People don't know that they have it. They walk around for many years quite often, don't know that they have it. All of a sudden one day they end up in the ER because their blood sugar is so out of control. So our purpose is to try and get into those communities, help those people to understand what the diseases are, what can happen as a result of having them uncontrolled, as well as checking to see if they do have them and then referring them on to an appropriate place for care. And that could be one of our community partners, it could be to the Polk Healthcare Plan, or it could be to their private physician if they have one. Often people will come to our mobile unit for that screening, and we would like them to do that. We don't want them going to the emergency department because the emergency department is the most costly care. If they can be screened and get to a primary care physician and have it taken care of at a primary care doctor's office, you're catching it hopefully earlier than if they go to the emergency room. Plus, you're getting it at a better cost, so it's not going to be as costly to the community as a whole or to that person if they're getting it in their primary care physician's office. And so we want people to get the care as soon as possible. And if we're in their community, they're going to feel a little more comfortable in coming for that screening. Basically, what Sam does on the mobile unit is he determines eligibility for services available through the Polk healthcare plan and some other services as well. Some of the things that you need to bring to be eligible for the Polk healthcare plan would include things like proof that you live in Polk County by 2 pieces of documentation, such as rent receipt, utility receipts, a driver's license with your current address. We also ask that you bring in proof of income because our income criteria is you must be at or below 100% of the federal poverty guideline to receive services. You need to bring with you your social security card, picture ID. You must have no other insurance available to you. And then we sit down, we have that interview, we just assess your situation and determine that eligibility. Okay, once the case manager determines that you're eligible for services with the Polk healthcare plan, we actually have you pick from a list of providers that we're contracted with to find a medical home for you. We then attempt to help you schedule that very first doctor's appointment so you're connected as soon as your card becomes eligible. Services with our program begin the 1st and the 15th of each month, so that person may have to wait a couple days before they can actually get to the doctor, but quite often if you can call that day, you can get an appointment scheduled for as soon as your card would begin. Most of these people that work for the Indigent Healthcare Division have worked in or around Polk County. They're residents of the county, and they're very dedicated to what they do. They're committed to serving the clients that we serve. They're committed to making sure that residents are able to get the services they need. We try and make sure that we're meeting the needs, and most of them have quite a bit of compassion and understanding of our community resources, and what our community needs are. Polk County is a very large county, and it takes quite a while to get from one side to the other, and we have many rural locations where we do not have offices. So it's important to have that mobile unit trying to get out to those communities. We have right now about 10 communities that we go to on a regular basis, and I have other communities who are calling me saying, can we get the mobile unit out here maybe once a month, twice a month? So we are making an effort to try and get to some additional places, and we try and shuffle our schedule. For instance, there's a couple places we go in Lake Wales, for instance, that during the summer we don't go there because they don't have a need for us to be there. So during that time period, we try and open it up and go to another location in Polk County that does have a need. So we do try and change our schedule up often. Not so often that people don't know where we're at, however, because we do publish that out on the web so that people can find us when they need to. We do use centralized scheduling, however, so we do have all of the community call Bartow, even though you may be seen in Point Siena or in Frostproof or way out north Kathleen or down in Brewster. We have centralized scheduling here in Bartow, so they all call the same number, so there's not multiple numbers to memorize and remember, but it's the one number, and then we can schedule you actually where it's the closest to your home.
Dr. Jackson, thank you so much for coming and giving us some insight into how obesity is affecting Polk County and how we can promote a healthier Polk.
Thank you very much. I appreciate being here.
You're very welcome. Today's show has come to a close, but we're not done talking about obesity just yet. For next month's episode, we will continue our conversation with Dr. Jackson and talk about how to combat obesity and start living a healthier lifestyle. I'm your host, Linda Pilkington. We hope to see you next time on Picture of Health.